Friends, in the present video I am going to give you an idea about pulmonary surgery in the question and answer format. So what are the indications for the pulmonary surgery? So mainly there are 5 indications for which the pulmonary surgery is needed. First one is malignancy, which is the most common cause is bronchial carcinoma and bronchial carcinoid. Inflammatory causes like lung abscess where there is a cavity filled up with the pus, tuberculosis, bronchiectasis, etc. Trauma in case of stab wound, gunshot wound, etc. Degenerative indications in case of large lung bulla, and congenital conditions like arteriovenous fistula, sequestrated lobe, and the lobar emphysema. These are the indications for pulmonary surgery. Let's see what are the incisions taken for the pulmonary surgery. So mainly that is two, okay, posterolateral incision and anterolateral incision. So most thoracic operations are performed through a posterolateral incision, and this incision follows the vertebral border of the scapula and the line of the rib, that is 5th, 6th, 7th, 8th, to the anterior angle of the costal margin. And this incision is taken from posterior to lateral side where the lower fibers of the trapezius, latissimus dorsi, serratus anterior, and the external and intercostal muscles are cut. High posterior extension of the incision also divides rhomboids major and the erector spinae group of muscles are also cut. An anterolateral incision, that is the second one, is taken for a closed mitral valvotomy, that is for your cardiac surgery, and is used by some surgeons for the pleurectomy as well. Let's see the next one. What are the different types of pulmonary surgery? So mainly there are 4 types: pneumonectomy, lobectomy, wedge resection, and the 4th one is your segmental resection. Now let's see all in detail. Pneumonectomy, here the entire lung is removed, and radical pneumonectomy, along with the entire lung, mediastinal lymph nodes and the parts of the chest wall may also be removed, and this will result in a cavity that is filled with the protein rich fluid and the fibrin. And the second type of the pulmonary surgery is lobectomy, where any of the 5 lobes may be removed in case of the tumor. Let's see the third one, segmental resection, where a segment, bronchopulmonary segment, is removed with its segmental artery and the bronchus, especially in conditions like a tuberculosis. Wedge resection, it is a non-anatomical resection used for the diagnosis in open lung biopsy and treatment of well-localized peripheral carcinomas in patients with the lung infection. Now let us see what are the complications of the pulmonary surgery. So mainly there are 2 types of complications seen following the pulmonary surgery. One is general complications and second one is local complications. First we'll see the local complications, that is hemorrhage, atelectasis or collapse, wound infection, surgical emphysema, pleural effusion, empyema, bronchopleural fistula, nerve damage while doing the operations like your phrenic nerve or the recurrent laryngeal nerve. Thoracotomy, wound pain, means at the site where the incision is taken there is a pain. Reoccurrence of the carcinoma, chest wall deformity, okay, maybe scoliosis, kyphosis and so on, and restricted arm movements, okay, stiffness in the joints, decrease in the range of movement, etc. What are the general complications? So the first one is your ventilatory insufficiency, atrial fibrillation, myocardial infarction, pulmonary embolus or the deep vein thrombosis, CVA, cerebrovascular accident, and the last one is your distant spread of the carcinoma. Now let's see the question number 5. What is bronchopleural fistula? It is a very commonly seen complications following pneumonectomy. It is a breakdown of the bronchial stem and it occurs around the 10th post-operative day following pneumonectomy, and if it is small, it may not be noticed until much later. And how it's recognized? It is recognized by the dyspnea, irritating cough and possible expectoration of the dark fluid, and associated empyema is mostly seen. The patient should set up and or turn into the operated side to prevent the spillover of infected fluid into the remaining lung. That is about the positioning. Let's see the question number 6, that is pre-operative physiotherapy goals for the pulmonary surgery. So here, to maintain full joint range of motion, to maintain adequate circulation, to maintain the correct posture, okay, to maintain adequate ventilation, encourage the general mobility, and educate the patient about how to do the coughing. These are some of the preoperative goals of physiotherapy. Now let's see the goals for PT management following pulmonary surgery. So to prevent the post-operative complications like deep vein thrombosis, atelectasis, etc., that is our one of the main goal for the PT management. Maintain the adequate ventilation so that good amount of air will go into the all the areas of the lung. Third, maintain the normal range of motion at different joints. Do the posture correction or the focus on the posture correction. Next, go with the early mobilization. So these are the goals of PT management. Let's see the eighth one, positioning in acute case of pulmonary surgery. The patient should be in the comfortable position in the sideline, and patient should be turned over the unaffected side. The body weight must be supported at the shoulder as the patient lowers onto his elbow and then take into the sideline position. You can use the pillows, should be arranged in position of the maximum comfort and supports the different drips, drains and the IV lines. Now let's see the last one, that is your most commonly given PT management following pulmonary surgery. So you need to educate the patient and family to increase their understanding about the disease process, expectations from the surgery, what are the possible outcomes of the surgery. Second, which is very important and gaining the attention globally, that is early mobilization with controlled breathing pattern to prevent the post-operative complications like atelectasis, pneumonia, deep vein thrombosis, etc. Now along with that, we need to give some exercises to improve and maintain the range of motion at the shoulder and the other joints. And the last one, we need to always focus on tailor-made approach. That means patient-specific exercise to improve the ADL and recreational activity and enhance the patient's ability for the self-management. So I wish this video will be